Hey everyone, I have been meaning to come back for another update, so it's about time to do that. I'm a little past the 4-month mark with my ACL surgery recovery. My last video, as I recall, was closer to about the 2.5-month mark. I slowed down the updates because I wanted to make sure that there was something meaningful to update on, as opposed to just making basically a post or a video saying, yeah, it's the same thing, nothing's really changed. Because you do get diminishing returns over time. You don't hit those milestones as often, and the milestones you do hit may not be as big. That's just the nature of things, the way the curve looks. You have a very steep slope early on with a whole lot of recovery. Even though there are going to be ups and downs, the overall trend is pretty steep, and then it sort of levels off. Maybe not completely, but it does get shallower. So that's what's been going on with me, which is what was expected. I'm not surprised by that. But I am pleased to say that in general, things look like they're doing okay. It appears that I'm still on track. Last week, right at the 4-month post-op mark, I had a meeting with my surgeon who checked everything out, and he did the ligament laxity tests and everything, and he seems to think that everything still feels like it's intact, everything's still good. I still don't feel like I can trust the knee completely. That's going to take many, many more months, maybe a year or more before I have the confidence back. But outside of confidence, there is still a sensation that things are not fully strong yet, or fully stable. But day-to-day stuff is good. My day-to-day routine is fine. Getting up and down stairs most of the time is not difficult. If I have a really rough workout or a really rough physical therapy session, then it takes a lot out of me. In fact, last week I had one where for a few days afterwards my knee was really on fire. And I imagine that could have had to do with the inactivity the couple weeks before, because during the holidays I wasn't going to PT. Just the clinic had slowed down. My therapist was out for a week and a half or something like that. And so we just kind of took a hiatus right there. And I did some exercises here at home, but it wasn't really... I would be lying if I said I was doing the same amount or the same intensity and whatnot as I was doing in the clinic. And something can be said for taking a break, taking a rest, but I may have rested a little too much. Anyway, the first day back was rough, and we did work hard. I pushed myself probably more than I should have, so it's not that they were forcing me to do stuff I couldn't tolerate. More like my ego and my eagerness also to keep going probably pushed it. So then I had to take it easy for a few days. So anyway, there it is. But let me show you what it's looking like now. Still feeling out of shape. I gotta get moving more, and I'm starting to do a little bit more testing with the kicks and all that. But that's where the scar is. I don't know if you think there's any difference from the last video, if you saw the last video. I think it is a little bit mellower. The coloration or discoloration in a couple of spots has been kind of relaxing a little bit. I still, of course, have the arthroscopic incision scar right there. But overall, I think things are going okay. As far as the exercises, let me back up so you can see all of me. As far as the exercises that I'm doing are concerned, I've progressed into a lot more squats, body weight squat kind of stuff like this without a brace on or anything. I am doing some monitored direction shifting. Most of this, the more aggressive stuff I'm still doing with a brace on. I'll show you the brace that I'm using now. I got my functional ACL brace in, I think, since last time. So you haven't seen that yet. But slower stuff I'm actually doing without this. And they recently did I guess call it a Y balance test, I think is what it was. But basically where you do a sort of one-legged squat. I'll do it on my stronger leg. But you do sort of a one-legged squat situation, and with your heel, with your foot, you push this little marker basically that's on a stick as far forward as you can, and you come out to one side as far as you can, and then you go out to the other side. So it makes a Y. Anyway, it's one of these sort of functional tests, and they look for symmetry between sides. And I was like 1% away from being, I think they wanted it to be 90%, and I was at 89% as far as what my left side was able to do. That is what I could do with my right leg while standing only on my surgical leg. What this leg could do compared to the other leg. So it was pretty close. And at 90%, they clear me formally to start running, to start jogging. I can tolerate jogging. I can actually do stuff like this right now. This is not a problem for me. Of course, I'm on carpet and haven't been doing a lot of it, but I can do some of this. Now, if I try to do high knees, it's a little trickier. So you notice I'm slowing down a little bit. But I couldn't do this in the last video. So I have improved a lot there. I do find myself sometimes, if I'm going across the parking lot or something, where I actually have to just do that. I don't have to think about it as much. I catch myself more automatically doing things like that now. With that being said, it's still inconsistent. So I have some days where it's still really sore. Like tomorrow I might wake up and my knee tells me, no, I'm not going to let you jog even a few steps. But then on a good day, I can tolerate a lot. I say a lot more than that. So that's part of the ongoing thing, that there are those ups and downs. You have good days and bad days. Let's see. Some of the exercises I've been doing, and I can't really rig it up, but I'm continuing to do things like, there's one where they actually wrap a band around my waist, and I'm hopping side to side and trying to do it without my knee buckling. So I'm trying to kind of land and stay stable to either side. And so they'll have something pulling to one side, and then I'll turn so that relative to my body, it's actually pulling from the other side, and I do the same thing. One side is far harder than the other. Typically it's easier when it's pulling from my right side, so that when I'm going in the direction that the band is pulling, I'm landing on my strong leg. So if I were to turn around, or if I have it pulling from this side, the weight's already pulling me in the direction of my weak leg, when I land there, there's a tendency to want to tip over. So that's the thing I've been working on. I do have my brace on when I'm doing that. And again, I'll show you the brace in a little bit. I'm also doing these banded reverse lunges, basically. So there will be a band, say, coming across to this leg. And you may notice actually that the, I guess, muscle tone is a little bit better now. I'm able to get a better contraction here, and I'll show you a little closer in a bit. But basically a band would be here. I can even put my foot through to kind of mimic it. There's something here attached to a machine or whatever, some weight, something anchored over on this side. And as I'm doing this, just kind of sliding back. So there's something, I can't really do it on the carpet here, but there is a sort of little pad where I'm kind of sliding my foot back and trying to stay upright and all that. These things do hurt. They're difficult for me. They also had me doing basically a one-leg split squat with an elevated rear foot. So something like this. And this is tricky. Like just doing these, just going this low hurts. So this is where one of my big deficits would be. If I do it on the other side, it can still be painful here because there's a tendency to want to kind of use that back leg. But if I just rely on my front leg, not a big deal. You can tell clearly this leg's a lot stronger than my left. If you put a gun to my head, I can do it, but it's definitely harder, and I am putting a little more weight on my back leg. So got some things like that. I'm not doing like weighted barbell squats or anything, though I suspect I'll be doing that soon-ish. I have been doing machine stuff at the gym. So when I go to the weight room, like here at my apartment, there's a leg press that works pretty well actually. I'm able to tolerate a reasonable amount of weight on it. Granted, your mileage varies, not all machines are created equal, but on this particular one, I'm getting up to into the 200, something like 240 pounds, I think, or something like that I was doing. Definitely not what I was able to do before, but it's something. And it feels good once I kind of get into a groove. Knee extensions were still tricky, or leg extensions on the machine. Leg curls, kind of same thing, because I'm still having some pain around the knee, a little bit of pain behind the knee and stuff. There's just some quirky stuff going on. Let me move the mouse, make sure that it doesn't, my monitor doesn't turn off. But yeah, overall things are going pretty well. I wanted to show you my brace, and also, again, my left knee is not even with my right, so this is obviously the non-operative leg. You can see a certain amount of contraction with my horrible lack of a tan, right? But you do see a reasonable amount of, vastus lateralis here and medialis here. You see that there's a decent contraction, not just on the outside, but also on the inside here, right? Well, for a long time, I couldn't get much on this side. And it's not even, but it's better. It's better than it was. So you can start seeing a little something there. And to the touch, it is tighter than it was. It's still kind of squishy, but I'll take what I can get. I still have fluid around the knee. You can actually see the tissue around my knee. Some of it is just fat, like I'm softer than I used to be, but some of it also is that there's a little bit more fluid accumulation on my left leg compared to my right. And that's annoying, but it'll take time. The large amount of swelling, the broad swelling in my knee is a lot better. So they do look a little bit more like twins. They're not perfect yet. You can still tell that this knee's a little goofy, but we're getting there. So last thing, the brace. This is my functional ACL brace. It's certainly less cumbersome to put on than my other brace. Let's see. And the way they typically want me to do it, if my knee is about 90 degrees here, they want it about 45 past that. So you can think of 45 degrees past the vertical, or 135 degrees total behind the knee, however you want to measure that. But the idea, you notice, it's all open in the back. I can slap this guy right on here, and I'm loosen this a bit. And then you kind of line it up, and this is a fairly rigid piece here. You can hear that, same thing here, right? And there's a line up where roughly we want this to be about even with the middle of the kneecap. That's about the line. And so I'm not perfect at it, but something like that. Make sure I pin down this front piece on the shin and this piece on the thigh. And then from here, we start off with this one. I believe this is the first one. Oh, that's the second one. It's the one right above it. So you have a series of clips here. And I know this is not the only type of functional ACL brace that there is, but this is the one that I got. So let me get even a little bit closer here. So what you can see, this piece here is hinged, right? So it turns, trying not to get my hand in the way, it turns like that. So I get these little teeth in and then swing it into place right there, and it'll click. And you may have even seen these little pieces here. And then I do the same thing for this next one. Teeth in, flip it, push until they both click. They both clicked at the same time there. Then I do my third one. Oh, this makes me feel really out of shape and squishy. It's like pinching my leg flesh. There we go, same thing. Sometimes I have to fiddle around with the pad and the straps a little bit, because the fluid in my leg changes a little bit from day to day. Click this into place. I want it to pinch my skin, catch a hair or something. And then I finish it off. So I go 1, 2, 3, 4, 5 in the front, which latches it right down in the front here. And you can see, maybe, let it focus. I bumped the desk a little bit there. So kind of from the back, it cinches it forward. Boom. And this is my functional ACL brace. And if I put it on well, it shouldn't slide. And it's not sliding too much right now. So I've gotten better about it. But if I need to bounce around a little bit more, okay, that's slippery. I don't want to stand on that. If I want to bounce around a little bit more, if I'm doing side-to-side kind of stuff, anything involving cutting or hard pivoting, I definitely need to have this on. Speaking of pivoting, I have started doing more kicks and stuff. Here, that doesn't feel as bad as it used to. Now, I can't bend my knee fully when I have this brace on. I do have most of my flexion back. That's another thing, by the way. I can sit on my knees now, just barely. It hurts a little, but I'm starting to be able to tolerate it. Of course, with the brace on, it's putting a little weird obstacle under my leg right now. But I can sit on both knees, at least on carpet, not on a hard floor yet. All right, let's see if I can get up here. Making progress. Right, but if I need to move side to side, definitely keeping this on here. Now, obviously, that was pivoting on my good leg. Pivoting on the other one, I'm still being careful, and there's a lot of friction on this floor because it's a carpet. But I'm getting some pivot, not as much. Like I can do a 90-degree pivot, okay, if I'm careful and I'm paying attention. If I hold on to something, take a little weight off by lifting myself up with my hand, much better, right? So still need to work on that. Still have a long way to go. My front kicks are slowly coming back, but I still don't have the medial and lateral stability and strength in this knee to really thrust forward. So if I'm doing a front kick with my left leg, so my right leg is my base, you see my pelvis kind of shooting forward here. That puts this kind of medial or valgus stress on the base knee. Boom. I can't do that on this leg, but I hope that eventually I'll be able to. So that's the update. I don't have any footage from a visit. I don't think I've got anything to add in. I'll double check actually before I upload this, and if I do have anything, I'll splice it in. But really, it was just a verbal update and a visual. So sorry if it was boring, but for the handful of people who might care, that's where I am at just over 4 months. And depending on how things go, once we approach about the 6-month mark, we're going to reevaluate that Y test. And hopefully by then I'm pretty even between sides. It was really just the front position, kind of doing what basically like a pistol squat. That was the one that was really hard and really painful to do. The left and right sides behind me, I'm almost identical between my surgical leg and my non-surgical leg. So that was really good. So I really just have to focus on being able to get lower and control things when I'm squatting and putting my leg forward to please them. And if that goes well, at the 6-month mark, or as we approach the 6-month mark, then they will formally approve me for running and stuff. And I'm doing like little jogs here and there, but I'm not including it as a major part of my routine. And we'll also start the process of like return to play prep. And then at about 9 months, their goal at about 9 months is to hopefully get me ready, and they do a return to play evaluation or return to sport evaluation. And do a bunch of tests on me, and it's going to suck probably, but then they can formally clear me to return to whatever I was doing. In this case, for me to return to judo in a fairly serious capacity. I'm definitely not ready yet, but my day-to-day stuff is good. I see progress happening. The brace is definitely helping, and this is going to be on whenever I start running, any kind of jumping. Like I'm going to keep this thing for a while. And when I return to judo, I'll still have this on, I think, for a long time. But that's my update. Almost 20 minutes here. I need to stop. But hopefully you found some of that interesting. Stay tuned. I will update again as milestones hit. So maybe between now and the 6-month mark, I'll have another update, or at 6 months. And I'm going to be uploading other stuff too. I recently did a reaction video for fun, a martial arts reaction video thing, and I might do some more of those. So if you like any of that, like the video, subscribe, share with your friends, make suggestions or comments here, ask questions if you have any. And that's all I got for you. So I hope you're doing well. Hope you got something out of this, and thanks for watching. Take care.